beach, but most of us are not ready for that yet. Dr. Rhys Branman is here to help, though, and especially today talking about mommy makeovers.
That's right.
Good morning.
Mommy makeovers. Good morning to you. It's good to see you.
Yeah. What is a mommy makeover?
Well, you know that babies sometimes aren't very kind to moms.
To the body.
To the body.
Yeah.
And they stretch out things like breasts and tummies. And some people do real well with babies, but other people just, you know, after breastfeeding and after carrying a child, they just get a lot of stretch marks.
Yeah.
A lot of loose skin. And the breast can sag a little bit too.
Yeah.
And so what a mommy makeover really is addresses those areas that have really succumb to the ravages of childbirth, as
right,
they say.
Exactly. Because these are women who, may, you know, otherwise might not have needed any help, but
that's right.
going through pregnancy can really take its toll.
It really can. And so what these procedures address is those areas that have been affected by childbirth. And that's why we call them a mommy makeover.
Mommy makeover.
And a lot of women just want to get back to where they started before having kids. And so, for example, with the breast, we'll do an augmentation or a lift or a combination of both. With the tummy, we can do liposuction. They may have gained a little bit of weight.
Right.
And we might remove some of that fat. We also may do an abdominoplasty and tighten up that loose skin or get rid of the wrinkles or stretch marks that occurred from childbirth.
Okay, you can take care of the stretch marks as well.
Most of them, yes. And we can also put them in places where they aren't seen. There
you go. That'll work just as well.
That's right.
We've got some pictures to look at so you can kind of explain what we're looking at. And here's a before and after right there.
Yeah. Well, this lady had a child, and you can see that she had lost a lot of volume in the breast, and so we did a breast augmentation for her. And so it gave her a little bit more fullness in the breast. And then if you look carefully at the picture to the left, you can see the little wrinkles and the stretch marks that are down there, and that bulging that was occurring in her lower tummy. And so what we did is we did a tummy tuck on her and really gave her a nice tight stomach.
Oh, she looks
and now all those stretch marks, if you kind of look carefully, the ones that were around her belly button are now down hidden in the bikini line area.
Okay.
And they're gone. And so now she can wear a bikini again.
Wow.
And we gave her a cute little belly button.
You can make the belly button cuter after maybe it's not so cute. You can make the belly
button cuter. That's absolutely right. And so this is what a mommy makeover is. It allows her to get back into a bikini again. She feels good about herself. She doesn't see all the things that happened after childbirth. And she's really excited about the whole thing.
She's a hot mama now.
She's a hot mama now.
Are there some women who are not good candidates for this? Or what's a good candidate and what's a bad candidate?
I think a good candidate is someone who has reasonable expectations, who wants to be sort of back to where they started. I think someone who has stretch marks all over their tummy, even in the upper tummy, they're not going to get rid of all those. But, you know, and if you're in good health, I think you're a good candidate. If you're in very poor health, I don't think an elective procedure is really right for you.
And I know you always like anyone who's looking at any kind of work like this to try to lose some weight on your own first.
You know, I do like that. I like people to be at an ideal weight, or not an ideal weight, but at least a weight that they can maintain. Just sort of going up and down isn't really good for them, and it's not good for the surgery either.
Right.
So
let's talk about the time frame of this. Can they do it all at once? Or if they're not comfortable with that, can they kind of spread it out? How does
they can do it all at once. We can do the breast augmentation or the breast surgery and the tummy surgery at the same time. Those surgeries can take up to 5 hours, but they can be done. It's one recovery, one surgery, and they get it all done at once. And I think, that is a reasonable way to go.
But if a woman says, I'm not ready to quite do it all, I just want to work on the breasts or the belly, they could do that too.
We could do the breast first. They could heal up, get all better, and then decide to do the tummy later on. We have people do that all the time.
You have lots of options for that. And then you guys have some specials as well?
Well, for the mommy makeover, we have a little special. If people want to get a breast augmentation, we'll throw in one side of lipo for them.
Oh, there you go.
There you go. So they can get ready for the summertime.
Free work as
That's right. That's right.
Let's just talk about the first process when they come in, because I know they're nervous, you know, and they probably haven't slept because they got this baby as well. How do you kind of take them through and help them make their decision on what to do?
Well, what we do is we bring them in and we discuss with them what their concerns are. And then we go step by step of what the procedures are that we can do for them to make them, feel better about themselves. And then we work with them in terms of you know, what do you do with a young child that's... So we get Dad involved, and Dad starts taking care of the kids and does some foot massages for Mom while she's healing up.
Yeah, that's a good point, because they are taking care of this young infant or toddler at least, and you know, she's trying to, you know, heal up from her surgery. Dad needs to kind of make sure that he's on board too.
That's right. We get Dad on board every time.
Very good. Good idea. All right, let's put up the information, of course, about Dr. Rhys Branman and the Cosmetic Surgery Center. There it is for you on Executive Center Drive, Little Rock, 227-0707. And of course, we've told you that they won Best of the Best. Yeah, which magazine was that?
That was Arkansas Democrat Gazette.
Democrat Gazette, Best of the Best for cosmetic surgery. So their patients think that they do a great job, so you might want to check them out. Thank you.
Thank you.
Appreciate it. Good luck with all the mommies out there.
There's a lot of mommies out there.
Very good. Thank you for coming. We'll see you next month.
Okay.
Okay.
Bye.